My name is Professor Shai Elizur, and I'm an IVF specialist, and I'm the consultant of the fertility treatment in the Endometriosis Center in Sheba. First, you have to remember that most women with endometriosis will get pregnant naturally. Most of the women will get pregnant naturally, and this is very important to understand and to know. However, there is an increased risk of infertility in patients with endometriosis, and it is very important to diagnose it early and to start treatment as early as possible. So if you're having suspicion, or if you know you have endometriosis and you're not succeeding to get pregnant, you should advise as soon as possible an infertility specialist to see if you need to get any treatment. Basically, endometriosis is an inflammatory disease that affects women in her reproductive age. And usually the symptoms are severe dysmenorrhea, that's pain during menstruation, severe dyspareunia, that's pain during intercourse, and sometimes chronic pelvic pain. So if you have one of those, you should try to get tested for endometriosis. And till now, still, we are very much delayed in the diagnosis of endometriosis, so you should try to get to a specialist in endometriosis to try to diagnose you. Well, if you want to get pregnant, most of the treatment, the medical treatment that we give to endometriosis will not be suitable for you, because all our treatment for the pain-related endometriosis are actually preventing pregnancy. These are the combined oral contraceptive pills, or progesterone-only pills, or IUD, intrauterine device with progesterone. So they work very well for the pain, but they prevent pregnancy. That's why when you want to get pregnant, you're not able to take those medications. So you have to use the complementary alternative medicine, which is always an optional, but we have to try to shorten the period of time for you to get pregnant. And that is why you should not wait so long before you get advice of infertility treatment, of infertility specialist, if you are not trying to conceive after 3, 4, or 5 months of trying to conceive.